Welcome to November, people. I think we've been here before in November, but anyway, November, and we've got one more in December. Super exciting. And then the year's done. You can pack up. But I know you're all pumped. Thanks for dialing in.
Hi, Wiki.
Oh, hi. Oh, hi, Marnie. How you going?
Hi, good. How are you?
I was like, oh, who's talking to me? There's initials. Quickly. How many MPs do I know? Good on you, Parko, dialing in.
Thank you.
How's Geelong?
Sleepy?
Oh, beautiful. Lovely.
Pretty good. But you're losing my face now. I'm turning my camera off.
Fair enough. That's right. I won't sound forever because I've got to drink my tea and eat my chocolate, which I've been told before is not a pleasant view for everyone in the webinar. So, Wiki, please turn your camera off when you do that. All right, folks, 60 people is a good number and November 19 at 1:04. So let's kick off today, webinar number 3, improving compliance. We're going to maximise your compliance and learning outcomes today. Zoe Yule is presenting and me and ChatGPT have put something together for you. It's not too crazy. But anyway, so Zoe has been, I think we should double check whether we can use the word is or was anymore. But anyway, I'm going to go with is a critical care RN who's been with AusMed so long. We're pretty sure she has tenure. In her 10 years here, she's done everything from writing a master's thesis on CPD impact to setting international standards for nursing education because why not? These days, she's the mastermind behind AusMed's accredited provider unit, keeping it the only Australian team with a shiny ANCC distinction for 4 consecutive cycles. She's also our in-house expert on clinical governance, risk and compliance, which basically makes her the coolest person you'll ever meet who talks about regulation for fun. Welcome, Zoe.
Thank you, Michelle. Michelle GPT, if you ever wanted to know what it looks like, there you go. Very kind. Thanks, Michelle GPT, for the introduction. I'm weirdly excited to talk about compliance. When I looked at the topic to what I see in front of me, I think we're going to have some fun, and I think today is going to be good. But welcome, everyone. I would just like to begin by acknowledging that I'm presenting today on the lands of the Wurundjeri Woi-wurrung people, and would like to pay my respects to them as the traditional owners of the land, and pay my respects to elders past, present and emerging, and of course acknowledge the enduring impact that they have on our learning practices. I think Michelle's given me enough of an introduction. I must say, though, I looked at this slide and it's so nice to see so many familiar faces here. And I thought I need to put some more fun facts in. And then I really struggled to think about what fun facts I could share. I did think I like gardening, but there's a lot of weeding in my garden. I don't think I would call that a passion. I love coffee. I have 2 kids. That's about as exciting as I got, but I'll work on that for next time. But thank you, Michelle, for your introduction. But let's get started. What we're going to cover today is first the basics of compliance, which is really a quick run through because I know you're all very familiar with that. We will look at some benchmarking and examine some current issues with compliance across the main sectors that we support here at AusMed. So aged care, acute care and disability care. And then I'm excited to have a look at reporting on compliance, but really focusing on how we can do it effectively, building your competence, your confidence and your capability. And finally, finish off with some practical strategies that can really look at improving your compliance rates with training. And when we get to that bit, I really encourage you all to share, pop ideas in the chat, let us know some of the things that you're doing that work well, and really encourage you to make the most of the opportunity where we're together here today. Okay, super basic to begin with though, what is compliance training? Well, we know it's the mandatory regulatory driven training and staff must complete it within that specific time frame to meet those essential standards. If it's not required by law, but it's encouraged for staff development, we call it optional or mandatory non-compliance. If you use AusMed, that'll be the terminology that you see. When it comes to measuring compliance, we can think of that as like a bundle of records or compliance requirements. And these requirements outline who must complete the training, when it's required, and what specifically is required. And these are the requirements that you're obviously creating either automatically or manually through a training plan. Again, very much just covering the basics right now. So your compliance rate reflects the percentage of staff that are meeting 100% of their mandatory learning requirements right now. We have some terminology that sits around compliance, and that's how we can start to describe and then feed into measuring it. So we at AusMed think of these types of terms: met, new, unmet, extended, and waived. If you're not currently using AusMed, then you might have a slightly different set of terminology that you're using. And I just encourage you, just be comfortable and familiar with this terminology, and it's really got to improve the way that we can describe and communicate various aspects around compliance. As we all know, there's a need and of course benefits to administering training and particularly staying compliant with that training. So we know that when we're compliant, we can uphold the relevant legal and regulatory standards, and that is a cost saving for our organisations. Money matters, and we can avoid, some really costly penalties and consequences of being in that non-compliant land. I think as well, though, we can, think about that. Compliance does reflect a moral and ethical commitment to safe and high quality care. People genuinely want to do the right thing, and it can actually bring the best out in people. We've got a good reputation, and I read an interesting study lately, Jardine and Elle. It was a Victorian study that looked at why nurses stayed and why nurses left. It was during the pandemic, so an asterisk on everything. But it was a really simple mind map. What's a good shift? What's a bad shift? What makes people attracted to an organisation, and what keeps them there? And a couple of the points said that a positive reputation attracts and can retain staff. Reputation matters. When we're sitting in non-compliance, that's affecting our reputation, and that could have a flow-on effect to your retention of staff. On the other side, quality of care really encourages staff. It attracts them to stay with the organisation. So interesting quantitative systematic review that I'll share in the reference list when we send the slides. With all that said, though, we know that there are, of course, some challenges and risks of non-compliance. We can think about them in terms of the risk, and being low to medium risk of non-compliance typically sees actions that are on your screen: direction, request for more information, and mandatory reassessment, as opposed to some of the more severe or non-compliance risk, where we really move into notices to remedy actions, civil penalties, injunctions, even revoking of approval. So compliance is important, but we know, there are some challenges around it. Specifically in disability care, the way they've described non-compliance and the impact of it is a little bit different, and I think that's because it really centres on the possible impact and risk to participant rights and well-being. So the way that non-compliance is grouped in disability care is across these 6 aspects, ranging from an error or mistake right through to fraud and corruption. So interesting use of language, I guess, describing where the regulation of that sector currently is. And no doubt, as we see the reforms in the years to come, some of this language will change. A key point, I guess, to reiterate that the way we see compliance is clearly it's important. Staying compliance is vital, but it's not the only way that we can achieve quality care. So quality care really extends beyond compliance, but today is about trying to do what we need to do and do it well. All right, so hopefully got the basics out the way. I want to respect that you're all adult learners. You're all, or many of you been in this area for a long time. So I'm going to switch into some benchmarking data that we've done at AusMed and just share some of the current issues with compliance. But the bulk of today is going to look at obviously reporting and those practical strategies. Okay, so what you're seeing on the screen are average training compliance rates across the three sectors from AusMed's platform. So you can see aged care, throw your hands up. You're sitting at the with the highest compliance rate of 74%. Acute care, so typically represents hospitals, sits at 68%, and disability care, 51%, interestingly. So we share benchmarking data because it can reveal, those sector-specific challenges and really encourage you to guide your organisations on where to focus. And of course, we're all sticky beaks. We all want to know what others are doing and how we sit compared to. So if you think of your compliance rate and you can just share or think, where am I in comparison to some of the sectors? I think what's most interesting though is looking at high performing organisations. So, thinking about what can we learn from them. We're lucky enough to work with many of those at AusMed, and I think the first thing to note would be, especially the larger organisations often set a compliance benchmark or KPI of 80% for mandatory training. The other aspects that we can learn from these high performing organisations is the things that they know. What do they know? What do they do? And they always know their total active requirements. They can easily identify and be able to manage unmet requirements, often in bulk. And so there's much less chasing staff to complete compliance requirements. As Michelle said, I'm a crit care registered nurse. I would absolutely, Michelle, say that I am still one. I still have my registration. And I think back to our tea room in ICU where we had, 2 A3 posters up on the wall, everyone's names and all of the mandatory training. And the amount of highlight, that was how our clinical educator at the time, showed you're not compliant, you still haven't done this. And now I think about, the system that AusMed uses and what we see our high performing organisations use, it's different. There's really little need for that physical chasing up of staff, and there's that live compliance monitoring ability. But I think, the key is that it comes down to the capability of the system. What is powerful. Knowledge is power, and the high performing organisation has got that information at their fingertips. I'm sure you'd all agree that maintaining focus on compliance is essential. We know it's vital for continuous improvement, and it really does demand that constant vigilance. So you all get emails from your relevant regulatory bodies, and I'd encourage you to read them. I know they can be lengthy and dry at times, but there is a lot of gold within these documents, and I'd encourage you to use those reports to gain insights and address similar concerns with within your organisation. Be proactive about this is what the sector's are struggling with at the moment. This is a metric that's gone down, and then how does that apply to our organisation? Are we doing well here, or is this an area for improvement? It's good risk management. The data is there, it's available, and it's really worthwhile reading those emails and viewing the reports. In terms of where you can specifically look, for the NSQHS standards, there's a section on their website that gives you assessment outcomes. So it's grouped by standards, of course, and a key part of that page are the actions that are most frequently rated as where improvements were required or recommended. And it's interesting that clinical governance is a critical area for improvement within acute care. So the graph that you're seeing on your screen here is the percentage of initial assessments that fully met the requirements. So the big numbers over here to your right, say blood management, for instance, 84% of providers in their initial assessment fully met that requirement. So compare that to 38% of clinical governance. This standard had the lowest compliance rate, meaning that only 38% of initial assessments fully met these requirements. So we know, clinical governance really is a pillar that shapes all of the subsequent standards, because when we think specifically about training, inadequately trained staff, we're going to see gaps in safety and quality practices. in terms of ineffective or a lack of risk management systems, which, really would sit at the core of clinical governance, that's going to go on and make it difficult to identify and manage those clinical risks. So clinical governance, if you're looking at an area to focus with and partner with your governing body and your executive team with, it really is on good governance and good clinical governance. Improved monitoring and evaluation of our quality and safety systems is going to see a lift in all subsequent standards. It's almost like $1 of money or time spent within a clinical governance standard is going to offer $3 payback for other standards. So that's where we go for the NSQHS data that I really recommend having a look at. In terms of disability care, it's much harder to find. Honestly, I've spent a lot of time on their website, and my heart and my patience goes out to those that are working in this sector. The way that I managed to stay across disability care complaints, news, performance reports is actually across two sections on their website. So there's a generic compliance and requirements aspect, and then there's news and events. And I really encourage you to sign up to the email. That's where I get a lot of the information around disability care compliance. And they're pretty quick, as you can see here in the screenshot. They tend to release a media release when there's a particular issue. You can click on it and read more about that. But I haven't managed, if anyone's got one or got a suggestion, please email me or pop it in the chat. I'm yet to find a sort of comprehensive report that gives that quarterly or even yearly kind of insight. In terms of aged care, though, I would say, the regulations really taken this area forward, and there's some really helpful benchmarking tools if you're in the aged care sector that can help you compare your performance with the rest of the sector. And you'll probably be familiar with the quarterly sector performance reports. One's just come out recently, and then there's the complaints reports. We've obviously got our national mandatory QI program data, and little asterisks on star ratings. There's they're slightly contentious. So there's been some interesting articles on them. So, you can use them theoretically, but I'd actually encourage you to read a little bit about some of the ways that that's calculated, and may not be the best source of data. But from those reports within aged care, we can, quite confidently say these are the current challenges or issues with aged care compliance. And if you look through the list here, all but one, financial management, I'd say, can be addressed through training and education initiatives. So from our complaints year in review and the sector performance for the last quarter, we're still seeing issues around medication administration, no surprises really. Personal hygiene, but just wanted to note there was some comments around oral hygiene, must never be forgotten. Staffing, of course, falls, food and nutrition, and communication. I mentioned financial management. So it's all in the report, but there's a brief summary, to reflect on where your areas of concern are within your compliance rates, where are your complaints data, and do they match with the current perspectives that the sector's just released. I mentioned, of course, a lot of those issues can be addressed carefully with training and education, and they're, of course, available on AusMed. So use it wisely. The theme of this, webinar series, if you've joined us for the first two so far, is that we can't spray and pray. For those high-risk clinical and care areas, training and education can improve it, but understand where the data is pointing you, and then use that training and education wisely to address the gap. And of course, if you're not already with us, we love hearing from you. Love hearing if there's a tricky compliance issue that your organisation's having, and you think training and education or more effective reporting might be a way to improve that. Reach out, even if that conversation doesn't lead to anything. We're trying to keep across what's happening, and love to hear any case studies that might be an opportunity for support. Alrighty, I've whizzed through the first two parts, which I'm really pleased with because I think, I'm keen to get into the real nitty-gritty about how to report on compliance and training effectively. And then, as I said, move into some of the practical strategies. So the way we see effective compliance management is really having three pillars in place. So the first is your core compliance settings and setting them up effectively. If you've with us as a customer and been on one of Michelle's manager workshops, she offers some really practical tips on how to get your settings right from the get-go. There's obviously an ongoing monitoring piece, and of course, reporting being that pillar of effective compliance management. So we'll look at each of these phases in more detail now. Okay, so whether you're setting up a new system for the first time or you're reviewing it before next year, it's a good time, being the 19th of November, to just check how your organization's core compliance settings are set up. Are they according to your needs? Are they doing what you need them to do? And have a think about, or what we encourage is to look at, what impact will extended requirements have on your reporting? And even just understanding the key terms. I mentioned some at the start, the ones that we use. If you've got a new staff member joining your team at this point in the year or early next year, here's some just basics around compliance that you might share to help them settle into the new role. But getting your core settings right from the get-go will hold you in good stead. Thinking about the ongoing monitoring of compliance, again, I'm drawing on Michelle, who's our Chief Customer Officer here. We really encourage you to manage accurate user compliance on an ongoing basis. And what that means is scheduling regular monthly tidy-ups of your users, your job roles, and your teams. However your system's set up, I know Michelle suggests even a monthly item in your calendar, just to go in and do a tidy up. We also want to see whatever's in your learning management system. We want to see that list always matches your HR list. With the changing of staff and new people coming and going, it's really good, really good practice to make sure that those lists always match. And also just know how to make changes to your organization structure. If you need to add new teams, new facilities, merge, there's a lot of movement. I know these things are often planned and take time, but here's some of the basic pillars of good monitoring. But can't stress that accurate HR and learning management system lists, and then the monthly tidy up are really good practices to get into. And then on to reporting. Again, it comes down to, I guess, what system you're using, but know what reports you have access to, what's available, and then choose the right report for your need. If you can, and it allows you to, or if you're an Excel whiz, it is good to create visual aids to help communicate where you're at in your progress. But essentially, what all this boils down to is audit capability. Who's been on holidays or been on sick leave, and you've got a call that you need to help with an audit? Pop your hand up. It's not a pleasant person, being that key the key person that knows how to access the system. What we're really trying to build here is a team of people that can, quite quickly and accurately generate an audit report, reduce that stress, and reduce that key person risk is a really critical thing to build within our teams and within our organisations. If you use AusMed, you'll see these as being familiar. There's many different types of reports that you can generate to suit your needs and the system. For the customers that are here with us, again, our manager workshops that are really hands-on, going through the system, how to select reports, manage the intricacies is the right place for us to share all of these details. But I did want to highlight, I guess, three types of reports coming back to a high-performing organisation that we're seeing, capability built around. So audit reports, team reports and board reports. So I'm just going to take a little bit of time over the next couple of slides to look at, what are the different ways that these reports are used, and how you might be able to benefit from them. So clearly an audit report, as its name suggests, it helps organisations prepare for and hopefully pass an audit, and really reduce that risk of any missing or failing to meet any regulatory requirements. What we're trying to do here is allow any person, as I said, to quickly and easily communicate where we're sitting in terms of learning requirements and our compliance rate to auditors. The way that we've set this up is 3 easy steps. It's identifying the scope of an audit, selecting the relevant requirements, and then also adding insights. So if there's any notes that you need to add, you can do that before reviewing. And just a brief screenshot there for you. So I'm coming back to it again, but really what we're trying to do is build that audit capability, make it easy, reduce the stress, so that anyone in an L&D team can generate these reports when required, and you're not called from a manager who's on while you're on sick leave or on holiday as the one that knows how to do it. In terms of a team report, what this does is enable your facilities, your operations managers to really easily see where things might be going well or where action's required. So being able to generate these automatically, saving the report and run them on a monthly basis really helps in that actual management of those unmet requirements. You're able to see whether it's a learning compliance or policy requirements, where your issues are. Is it a certain team or is it a certain facility? And then being able to easily and quickly follow up is really going to help improve that compliance rate. You're able to accurately see where my issues are, and then, how can I act on that? And then the third type of report that, we're really seeing a lot of value being created with is board reports. What this is a really visual, digestible information that really does help reduce that risk and liability. So it's typically only one number presented as an overall learning compliance rate within your organisation, but in alignment with your KPI, so how you're progressing towards achieving that KPI. And it's designed to help the governing body or your board understand and mitigate organisational risk. So think of it as that big picture lay of the land at a frequency or cadence that suits your organisation, be it typically monthly or quarterly. So it's been these 3 use cases from high-performing organisations, the audit, board and team reports, that have created the demand and the insights for us to launch AusMed Intelligence, which for existing customers, scan the QR code, you can get a quote. If you don't use AusMed, you can still feel free to reach out and we can have a chat. But essentially what it's designed to do is mitigate risk. It's designed to help build that audit capability within the team, making it quicker, easier, more accurate responses and reporting during audits. So we start with a baseline of better ongoing management of compliance, better effective communication to the board level, and then in those stressful times of need, being able to quickly and easily generate those reports. Alrighty, I think we're going surprisingly well for time today, which is great. I'm going to move into the last part of our webinar today, and that's look at what strategies can we put in place to improve compliance. And I'm going to tackle it in 2 parts. The first part is just looking at some of our common challenges, how we can overcome them, and then share some practical strategies that we see organisations using, and also, just some getting a little bit creative with our best practices. Okay, so in terms of overcoming common challenges, this is a good place to start. The webinar's around improving compliance. Let's look at some of the things that we can often struggle with, and I'm sure they'll resonate with you. We've got unclear training requirements. What do we need? What should be mandatory? What shouldn't? particularly if you work across different states, we've got varied certification and trainer requirements. Who can sign off on what? Difficulty reporting, I think, is pretty straightforward. What do I need to report on? What frequency? How do I present it? Low engagement. Who struggles with this? Getting people to complete the compliance training. Interesting, we see this probably more than what we'd like, but when we've got misaligned policies and training. So learners have done training and then the policy doesn't match. And finally, I think this talks, quite accurately to organisations like nursing agencies or recruitment agencies. When we've got multiple sectors, multiple staff or job roles, and multiple compliance requirements, it is challenging to navigate. So let's move into looking at some of the solutions for these common challenges. All right, so in terms of unclear training requirements, as I mentioned, throughout this webinar series, we've really tried to encourage you to conduct that annual gap analysis or needs assessment that I know many of you are doing right now or have already done. And the key to that is to map your exact training requirements to the standards. So you know what you need to implement, what training plans they should be in, and really make sure that they're tied to a need. Michelle's written a fabulous article. I'll share it shortly in the last section, but she's talked about some of the creative ways that we can tackle the challenge of different certification and trainer requirements. So I won't spoil the article too much, but essentially what she suggests is creating in-house training champions. So you certify key team members, and then you've got that champion that can then deliver subsequent sessions to other staff. So you're reducing costs, reducing reliance on external trainers, and building that capability within your own organisation to be able to deliver training. In terms of reporting, we're looking at avoiding the manual spreadsheets. I think that's where we can have issues. Leveraging platforms like AusMed or whatever system you're using, but really looking at getting that quick, accurate, and comprehensive compliance reporting. Our compliance rate is only as good as the accuracy of the data that we're inputting into it. Last three challenges here, we're going to tackle these a little bit more shortly, but low engagement in training. As we've shared during the series, we really recommend a staggered scheduling of compliance training, making sure it's targeted to specific job roles, and that balanced or appropriate use of optional training. We want to reduce that training fatigue. When an item is absolutely mandatory, we want someone to take that seriously. We want them to actually know that this matters and I need to do it. If we're bombarding and overloading, a learner's going to get that alert fatigue and think, okay, it's another item. Be precise, have that accurate needs assessment, and know exactly what is mandatory, and use that mandatory or that compliance training wisely. In terms of the challenge around policies not matching with training, it is an issue. We were talking about it in a meeting this morning, and that was, I think, it was almost 10 years ago. Cynthia, who was the founder of AusMed, did research around barriers to translating education and training into practice. And one of the most common barriers that stops someone from taking that knowledge of what they've learned and applying it to practice was that the policy and the procedure of the workplace didn't match to what the content of the training was saying. So, if you take a wound, for example, someone's done training on wound assessment or wound management, but then they go to actually perform the task and the internal policy or procedure doesn't match. Having one system obviously can help integrate your policies with learning, but it is that collaboration and coordination between an education or L&D and a quality team that's really going to address that issue as well. And then I can't stress, the importance of that accurate assessment and a centralized training system to support someone like a recruitment agency, where you've got multiple standards, multiple sites, multiple sectors, and very, diverse set of compliance requirements. A good system will hold you in good stance, in good stead for them. Okay, here's where I really encourage you, jump in the chat if you can, if you've got something to add. We're going to look now at some practical strategies to improve compliance. First things first, link learning to an outcome. How do we do that? Well, we want our we want to connect, let's say, training that was completed 2 months ago to an improvement that we're seeing today. This has to be, to actually measure this, we need it to be documented, and it's typically in your continuous improvement plan. What this does is link compliance, not just with learning, but to your organization's overall strategy. All right, so during an audit, showcasing this is really powerful. Now, I know you're hearing, okay, you've said it, but how? How do I do it? How do I actually do it? It comes down to data, right? Now, you may recall this slide in our last webinar on mandatory training. We talked about what data can you use to actually validate there's a need for training and education. That same data is what you can go back to and use to actually link that training to an outcome. So if you look at consumer data, for instance, you've got feedback, you've got a complaint that was around documentation, or communication, whatever it might be. That data that has ideally prompted you to deliver training on documentation communication, can you look at what it was before you did the training, and what it is now? You've got a whole assortment here. Quality indicators, of course. Everyone has mandatory quality indicator data on falls, pressure injuries, medication safety, a number of different topics. Can you look at, before we implemented this training, this was where our data sat. Now that we've implemented training, here's where our data set sits. So just beginning to think about linking a particular training or education initiative to a data is absolutely a strategy to improve compliance. Why? Because it connects us to something more than just doing training. We can actually share with our team, this is how it made a measurable difference. This is how patient care improved. This is what we stopped. We heard the voice of, a quick video. Get your phone out, take a video of someone and share, this is what it was like to have a fall. It was awful. And tack on that this is what we're stopping, adding a person to that story, getting creative about, how we can assess and then use this data is absolutely going to make a difference. The next strategy that we've brainstormed and would really encourage you to consider is to think about not just basic documentation around compliance training, but then a little bit more of a substantial reflection on that initiative. So we're very used to, documenting basic details, name, date, participants, topics covered, objectives, but then ideally go on and reflect on, why was it needed? Why did we implement it? Because of this particular data. What were our learning outcomes? How did the organisation and the people in our care benefit as a result of it? Did we assess any barriers to translation, and how might we overcome them? And then attach your evidence here to your continuous improvement plans. And you've got a really robust documentation and reflection on that training or education initiative. As I mentioned earlier when we were talking about reporting, thinking about your skills, your capability, and your team's audit capability or capacity to get that accurate data is definitely something we would recommend. You know, as educators, as L&D teams, we also have our own knowledge gaps and areas that we can improve. I think we're always thinking about how do we support our learners and our teams, but thinking about your own capabilities around audits, you know, might be something that you have a look at as well. I guess I can't stress it enough. You know, reducing that key person risk. We want at least, you know, 2 or 3 people within the organisation to be able to deliver during an audit. It's going to improve consistency. It's going to reduce that vulnerability and stress, but also build confidence throughout the organisation. Think of it like, you know, muscle mass. The more we practice something, the easier it gets. You know, maybe you run informal training audits a couple of times a year and you identify gaps and then, you know, build confidence in staff. The repeated exposure to a variable situation is what creates experience, and you know, building experience around responding during an audit is really critical. The next thing is, I guess, slightly bigger picture, and it's to improve compliance. We can't just, you know, keep on doing the same thing. We need to align not just our systems and processes, but our people. And this is really the leadership and the culture piece. So achieving compliance, you know, it really isn't about just passing audits. We obviously want to and we need to, but how do we create a culture of providing excellent care? How do we create the culture around continuous improvement? I saw a heading recently that caught my eye, and it was, you know, building a compliance culture. And I thought, yeah, I wonder, is that the kind of culture? What would that culture look like? And I think building a culture around continuous learning or improvement, you know, maybe sits better within the organisations that we work in. When we're looking after genuine people, we want to actually move beyond that tick box approach, and really putting our leadership and culture hat on and thinking about, are our systems aligned? You know, are there redundancies in process? Are there quick wins that we can, you know, reduce some inefficiencies and improve effectiveness? What ways is our organisation actually building intrinsic and extrinsic motivations? You know, are we doing anything to actually inspire our teams? We're full of wonderful people. You're all here today. You're all learning. How do we create that culture within our teams as well? And I must say, over the past week, that's probably where I've done the most thinking. You know, this is what gets me excited around compliance is essentially we need to empower our learners, right? We can have good systems, we can have good processes, we can have a good, you know, reporting capability within ourselves. But what we're trying to do is enable and inspire others to actually complete learning and take that learning into practice. Clearly, it's, you know, it hinges on how engaging that learning is. But, you know, I started to think about what are the kind of pillars around empowering learners? And Michelle's put some pen to paper on this as well. How do we create a learning community? How do we create and foster personal connections within compliance training? We have to trust that and respect that the people that we're educating and enabling through training, they're adults. You know, how do we support them? So I don't have time to go through all of the strategies here, but I really encourage you to take a look at the guides. You know, 60 minutes for a webinar is a short time, but we think about what we can genuinely share with you to not just achieve a high compliance rate, but to make the learning count and to help your staff, you know, translate that training and education into practice. So stay tuned. It'll be tomorrow, maybe Thursday at the latest, where we publish these 2 guides. They're really designed to be practical in nature. They're free, of course. One is a generic guide to improving compliance with training, which is a lot of what we've covered today. And the second one is around empowering learners to improve compliance. compliance. So some, just small quirky strategies that can connect that purpose and build that empowerment around, doing that basic mandatory training. And excited to share this one with you. So a couple of articles that Michelle's written. One went live yesterday. The other one is coming very, very soon. And as I mentioned, Michelle, who's got a vast amount of industry experience around this, looks at some of the maybe unconventional ways that you can save time, money, but most importantly, your sanity when it comes to navigating compliance, particularly working out what certifications you need, what's mandatory, who can do what. She breaks it down. There's a really helpful table. And I always laugh every time I read one of her articles. I've always got a smile on my face. I'm always laughing, and I'm sure you'll enjoy it too. And a bit of a cheeky one, what L&D can learn from OnlyFans. Just a little teaser for you there. Really, really interesting.
The one from Pornhub as well now. Sorry.
Oh, no.
Episode 2.
We're recording, remember, Michelle?
It's just a business name, Zoe. It's just a business name. That's all I said.
And genuinely, who else do you know within the L&D community that's writing an article like this? She pushes the boundaries, but surprisingly, there's a lot that we can learn. I mentioned it, empowering learners, building a sense of community, and creating personal connections between basic compliance training and the learner doing it. Well, surprisingly, we have a lot to learn. So as always, if you're not already a subscriber, it's 1 email a week. It's every Tuesday. You'll get one in about an hour once I finish the webinar and get this week sent out. But we try and deliver you, some helpful resources and updates around AusMed that we think will benefit your role. And really excited for our final webinar, 10th of December. And what we will do is build on what we've covered. So we've done, if you haven't attended, you can always watch the recording. But the first webinar was on induction training, and importantly, how do we streamline it? Second was on best practices to mandatory training. And obviously today is around improving compliance. We have to do it. How do we try and do it effectively and deliver what our organisations and the people in our care need? The next webinar, though, I really hope to challenge some of the traditional training methods and think about the impact of education. So look at how do we build a more capable, a more competent workplace, and how do we drive continuous improvement? So if you're ready to transform your approach to compliance training and look at moving beyond compliance to all the other wonderful ways that we can retain, upskill, cross-skill, side-skill the people within our teams, then I really look forward to seeing you at the final webinar. So I think we have covered all of the objectives for today. I am going to have a quick look in our chat if there's any questions, but encourage you to pop your hands up. All under control. There you have it, Michelle. Thank you very much.
You might be free to go, Zoe. Thanks for joining you, folks. Happy Tuesday. Hope your rundown to Christmas is good, and I hope we see you at the next and last webinar for the year.
Thanks, everyone.
All right, bye, folks.
See you next time. Bye-bye.
Just wanted to say thanks, guys. Another great one.
Thank you.
Thank you.
Thanks, Melissa. See you next time.